Hi, welcome to our channel. Today, I'm going to discuss why your teeth hurt when you consume cold or hot foods. You re-enjoying an ice cream cone on a hot summer day and you bite down on that delicious ice cream and yelp because it feels so good. But then wince moments later when the ice cream melts and hits your teeth. Or maybe you have coffee with your breakfast and the first sip is so refreshing, but then the next sip brings a jolt of pain. If you are someone who winces or recoils from hot or cold foods and drinks, I feel your pain because I used to be just like you. And today we're going to get to the bottom of this. We're going to cover 3 key points. Number 1, why does eating hot or cold food hurt your teeth? Number 2, why might this be happening to you? And 3, what can you do about it? Okay, let's start with point number 1. Why does eating hot or cold food hurt your teeth? To understand this, we have to take a quick look at the anatomy of a tooth. The outermost layer of a tooth is a hard, shiny substance called enamel, which protects the inner layers of the tooth. Underneath the enamel is the dentin, which makes up the bulk of the tooth. Dentin is a calcified tissue and is quite hard, but it is softer than enamel. Both the enamel and the dentin contain microscopic tubules, tiny little channels that run from the surface of the tooth all the way down to the center of the tooth. These channels allow nutrients and minerals to pass through to the center of the tooth to nourish what is called the pulp. The pulp is the innermost layer of the tooth and it contains nerves and blood vessels. Now, if these microscopic channels in the dentin are exposed to the oral environment, temperature changes in the foods and drinks that we eat and consume can travel down those tubules and stimulate the nerve located in the pulp, and that stimulation can cause that sharp, sudden pain that you feel when consuming hot or cold foods. Alright, now that we know how the nerves in the tooth work, let's talk about why this might be happening to you. One of the most common reasons for exposed dentinal tubules is tooth wear. Tooth wear can occur in 2 ways. It can be caused by abrasion or erosion. Abrasion is when the enamel and dentin are worn away by friction. For example, if you use a hard, bristled toothbrush or are overly aggressive when brushing your teeth, you can wear away the enamel and expose the dentin. If you want to learn more about how to brush your teeth properly, check out the video where I demonstrate how to brush your teeth. Erosion occurs when the enamel and dentin are dissolved by acids. Many foods and drinks such as soda, citrus fruits, sports drinks, wine and others contain acids that can erode the enamel and expose the dentin. Over time, these acids weaken the enamel and literally eat away at the tooth structure. The second reason for exposed dentin is gum recession. Our gums can recede or pull back for various reasons, and as they recede, they can expose the root surface of the tooth. Unlike the enamel on the crown of the tooth, the roots are covered in a softer material called cementum, is softer than enamel and is highly sensitive. When exposed, this can cause pain when eating hot or cold foods. The third reason for exposed dentin is dental caries or decay. When bacteria infect the tissues of the tooth, they produce acids that create holes in the enamel and dentin. As the decay progresses, it can expose the dentin to the oral environment and cause pain when eating hot or cold foods. Another reason is cracked teeth or fractures. Sometimes people will have a crack in their teeth that can extend from the chewing surface down into the dentin and expose the inner tooth structure. Even a hairline crack can be enough for temperature to travel down and stimulate the nerve. This is one reason why it's important to have any tooth pain investigated by your dentist, because it could be something more serious, like a crack. And lastly, recent dental work. It is very common for people to experience some sensitivity after certain dental procedures. This is usually due to the removal of decay or the rough margins around a filling or crown, which can expose the dentin during the procedure. Normally, this type of sensitivity goes away within a week or two as the body heals and adjusts. However, if the sensitivity persists for longer than that, definitely see your dentist to have it checked. So, to recap, there are 4 main reasons why your teeth may be sensitive to hot and cold foods. 1. Tooth wear from abrasion or erosion. 2. Gum recession. 3. Decay or a cracked tooth. And number 4, recent dental work. Okay, let's move on to the third point. What can you do about this? Well, first off, I wouldn't worry too much if you don't have any other symptoms, such as pain when biting down or pain that persists for long periods of time. If you only feel pain when consuming hot or cold foods and drinks, it's probably just dentin hypersensitivity, which is not a disease but a symptom of an underlying issue. However, please note that this video is not intended to diagnose or treat any condition. The best thing to do is to visit your dentist and get a proper diagnosis. Your dentist will identify the cause of the sensitivity and recommend the appropriate treatment. That being said, there are a few things that you can try at home to help reduce the sensitivity. 1. Use a soft bristled toothbrush and a toothpaste that is formulated for sensitive teeth. Toothpastes for sensitive teeth typically contain potassium nitrate or stannous fluoride, which block the transmission of pain signals in the teeth. Be sure to brush gently and avoid brushing too aggressively. In addition to seeing your dentist, if you notice that your teeth are feeling extra sensitive to heat, not just cold, this could be a warning sign that the nerve inside the tooth has become infected or inflamed. This usually means that you need a checkup with your dentist. So please see your dentist right away. I hope this was helpful. Please share this video if it was helpful to you. Catch you later, and remember to take care of yourself out there.